Warm greetings to everyone. The topic for presentation is effect of school-based yoga program on nocturnal enuresis in 6 to 10-year-old children, a randomized controlled trial. This is a self-funded project. Nocturnal enuresis is an unconscious leakage of urine during sleep which occurs at least 3 times in a week in children aged 5 years and above in the absence of any congenital or acquired defects of the CNA. The prevalence of nocturnal enuresis is 7.61 to 16.35% in India. It is one of the major complaints most commonly seen in boys than in girls. Primary nocturnal enuresis is caused due to various reasons, so the exact cause is unknown. Aneurysmic children often experience chronic stress which have a negative impact on their self-concept and self-esteem, which leads to psychological problems affecting their academic performance like concentration levels, absenteeism in school, anxiety, depression, inferiority complex, etc. The parents of these children also face tremendous stress due to their child's condition, resort to punishment and abuse to cure the child as they are incapable to tackle such situation. The primary management includes behavioral modification therapy, medications, positive reinforcement, pelvic floor muscle strengthening, classical conditioning and hypnotherapy. Yoga, an ancient Indian form of physical activity, targets the internal organs of the body and the mind through various asanas and meditation that helps in strengthening the weak muscles, improving flexibility, relaxing and de-stressing the body and the mind. A pilot study was conducted in India on boys which proved that yoga was helpful in nocturnal enuresis. There is a dearth of studies conducted on the benefits of yoga in children with nocturnal enuresis. Hence, the present study intends to find the effect of school-based yoga program on widening frequency, behavioral problems, and quality of life in 6 to 10-year-old children with nocturnal enuresis using voiding diary, child behavior checklist, and pediatric incontinence questionnaire. This was a randomized controlled trial which was conducted in 2 phases targeting children of the age group 6 to 10-year-old with nocturnal enuresis. The first phase was the prevalence study while the second phase was the interventional program. Ethical clearance was obtained from the Institutional Ethical Committee. 20 schools were selected based on convenience. Some pamphlets containing details of the free nocturnal enuresis camp were distributed to the children of these schools. 10,500 children were screened for nocturnal enuresis from these schools. Around 70 children reported along with their parents to the free nocturnal enuresis camp and they were educated about nocturnal enuresis assessed by the urologist and prescribed medication named MELT 120 mcg and were later referred to the physiotherapist for further intervention program. The physiotherapist is the primary investigator who explained the details of the study. The exclusion criteria was children having CP, cerebral that is cerebral palsy, metabolic disorders, genetic disorders, purge incontinence, diurnal enuresis, UTI. 47 eligible participants were randomly allocated to 2 groups, that is the school-based yoga program and the conventional group, where school-based yoga program had 24 participants and conventional group had 23 participants. Behavioral modification therapy, medications, and bladder training was common to both the groups, while the school-based yoga program was given to Group A, that is the yoga group, in addition for 6 weeks, lasting for 45 minutes, which was given twice in a week. A baseline assessment was taken on day 1 of the intervention program and were later follow up. During the follow-up period, one was lost to follow-up in the group A as the therapist was unable to contact them. So the group A and group B had 23 participants during the follow-up period. Voiding diary was maintained in throughout the study period as well as 1 week prior also to the study period and 1 week post the study period and as well as 1 month post the study period. CBCL and the PINQ questionnaire were maintained prior and post the study period. For analysis, there were 23 participants in both the groups. This was the interventional program where medication, behavioral modification therapy, and bladder training were common to both the groups, while structured yoga program was given only to Group A in the form of Chakrasana, Uttasana, Paschimottanasana, Baddha Konasana, etc. results. In this table, we see that there were weekly improvements seen in the voiding frequency, and these improvements were observed from week 3 onwards, which shows that at least 3 weeks of intervention is required for the effect of the therapy to start, and also shows that there were a better bladder control observed in these children after week 3 onwards. This table shows the comparison of the outcome measures within the groups in terms of voiding frequency, CBCL, and the pediatric incontinence questionnaire. Statistically significant result was observed in all the groups. Um, the yoga group showed better percentage of improvement, that is 97.87%, while the control group showed 86.14%. The CBCL scores had also improved, and the statistically significant results were obtained, depicting better control of the behavioral problems. The quality of the life also improved greatly post the intervention. Table 3 shows the significant improvements in the anxiousness and the attention domains of the CBCL. Key points to be noted are school-based yoga program showed better results than the conventional group. Combination therapy had given better results. Reduction in the behavioral problems was seen post-intervention, especially in domains of anxiety and attention. Quality of the life improved post-intervention. Reduction in the voiding frequency was observed from third week onwards. Adherence rate was a contributing factor. Limitations. The principal investigator was not blinded to the randomization of the subjects. Combination of treatment strategy was utilized. Compliance of the yoga program at home was low. Conclusion. The school-based yoga program, in addition to medication and behavioral therapy, was beneficial in 6 to 10-year-old children with nocturnal enuresis. Long-term follow-up should be done to see the benefits of yoga. Yoga should be used as an individual treatment strategy. Awareness programs should be conducted about nocturnal enuresis. Thank you.